Our final Beyond Big Pharma segment, President Trump's Make America Healthy Again commission, led by Health and Human Services Secretary Bobby Kennedy Jr., has just unveiled a groundbreaking report exposing the alarming rise in chronic diseases among U.S. youth, from obesity and autism to depression and cancer, blaming ultra-processed foods, environmental toxins, and over-medication. The report calls for a seismic shift in America's food, health, and scientific systems to prioritize prevention and resilience. With 40% of children battling chronic conditions and 75% of young adults unfit for military service, the stakes couldn't be higher. Pam Killeen is a health and wellness coach, co-author of The Great Bird Flu Hoax, and host of the Circadian Reboot with Pam Killeen podcast. Pam, welcome back one last time. How are you?
I'm great, Richard. Sad to see you go, though. Thank you so much for all of these episodes that we've had together, and I wish you all the best in your future endeavors. So I'll start with that, but also lead into this story about this new MAHA report. And it is explosive. I mean, the mainstream media has been covering it. And of course, the sponsors won't be happy about what they're saying still about things like ultra-processed foods. I see a lot of pushback, a lot of criticism towards RFK Jr. for doing this report. But of course, it's going to step on a lot of toes when you look at the junk that is being sold in their advertising. And they're culpable. Every single one of these people in mainstream media that is advertising this poison is culpable and has contributed towards this crisis that we're seeing with especially our youth today. I mean, they're saying that our youth are so sick today that it's the first generation that will not outlive their parents. I mean, this is a real crisis.
Yeah. I mean, and for the United States, well, here in Canada too, when you have 75% of young adults unfit for military service, that's a national security issue as well. But one of the things that really struck me in this commission report, it notes a staggering, get this, 1,400% increase in antidepressant prescriptions for kids between 1987 and 2014. Despite, questionable long-term benefits. Talk to me about that.
Right. Our kids are having mood problems, and unfortunately their mood problems are being duct taped with Prozac, and what they're struggling with is not a Prozac deficiency. And I say that figuratively because there are a lot of different antidepressants on the market. But instead of looking towards the root cause of the problem, unfortunately, they're poisoning our children even more. And these antidepressants, unfortunately, have devastating side effects, including things like homicidal and suicidal thoughts. And so, unfortunately, their eye has been off the target. They have no business criticizing RFK Jr. for doing this report when you see these kinds of staggering numbers in the area of our children struggling with depression. Now, one thing that the report did point out that, I'm a big fan of this, Richard, but they did talk about this transition from children playing outside, getting fresh air and sunshine, and now they're secluded in houses looking on screens and absorbing too much of this artificial light. And so they did talk about it, but they didn't talk about it in detail. And yet I think it is pivotal to this problem as well, because unfortunately light will affect your hormones, will affect your neurotransmitters, and therefore will affect things like serotonin and dopamine.
What strategies would you suggest to encourage kids to spend more time outdoors? Maybe not just encourage. I mean, how do we, in a sense, I guess, force kids outdoors and foster a healthier, more active lifestyle?
Well, we're their mentors, aren't we? I mean, we really need to be outside ourselves, playing tennis, playing golf, playing tag. It doesn't matter. We need to be outside, and the adults, the parents, need to be leaders in this. You can't count on the government, to tell people to play outside. It's the parents that need to be doing it. And I look outside on my street all the time, and I'm just wishing for the day that I see kids back outside playing, because I know this is going to contribute to a better healthcare system. We're not going to be bleeding our healthcare system dry as we are right now with so much illness and so much disease in society if we could just spend more time outside. Now, I'm oversimplifying this issue because, of course, food is a factor as well, and we need to return to eating nutrient-dense foods. And one thing that the report is being criticized for is that it doesn't offer solutions. You just asked about solutions, and I said we need to act as examples and be outside more. But the sad part is there are solutions in terms of nutrition, and they're saying we need to do more research to see what whole food, nutrient-dense foods are going to do to our health. Well, we already have that research, and they're ignoring it. It was done 100 years ago with people like Dr. Weston A. Price, who studied primitive tribes, and he could see how radiantly healthy the cultures were as long as they were eating local, nutrient-dense foods, and they didn't have these ultra-processed foods in their diets. They also spent more time outside, and they were radiantly healthy. The answers are so clear and so simple, Richard. Unfortunately, there's just too much money to be made with all this junk that is on the market.
The MAHA Commission emphasizes prevention and resilience as critical to reversing this health crisis. What do you think are the most effective preventative measures parents can implement early in a child's life to build long-term health and resilience?
Routine. You have to get children into a healthy routine. Get them to bed at a decent hour, whether it's 8, 9 o'clock at night, depends on their age, of course, and get them up at a consistent time. Make sure that their room is pitch black when they're sleeping. Make sure after sunset that they're not exposed to screens. Again, you're going to be eating breakfast, lunch, and dinner at the same time, hopefully every single day, because this all contributes to a healthy biology. And so all of these very simple things, things that we actually did naturally maybe 100 years ago, that now people might hear me say these things and think, oh, it's impossible. I've got soccer practice. I've got this late night tournament or whatever. I mean, we have to set limits, and we have to learn to say no, because our children's health is far too precious, and we cannot make these types of compromises any longer. We need to be strict. We need to come up with guidelines. We need to come up with healthy routines so that our children have a really strong foundation and can carry that strong foundation into adulthood.
Well, Robert Kennedy Jr. has a monumental task ahead of him. I think he's off to a great start. What are they, about 140 days, maybe less, into this administration? He's moving at lightning speed. But it is a huge issue he has to tackle here, and we wish him well. Pam, thank you so much for all of your amazing insights over the last almost a year. Thank you so much.
Thank you for having me on the show. And again, I wish you all the best in your future endeavors.
Pam Killeen is a health and wellness coach, co-author of The Great Bird Flu Hoax, and host of the Circadian Reboot with Pam Killeen podcast, PamKilleen.com. Pam Killeen, Killeen, PamKilleen.com.